Hi, it's me, Krista. Today I'm going to go over the respiratory system in my cat. A little bit later there will be a second video attached going over the digestive system within my cat. I'm using my webcam today because I used your advice, using something that's more still, less shaking, and if I need so, I'll use my camera to zoom in on some important features. So I hope you enjoy. Thank you. Okay, first I'm going to start with the larynx area. This is the larynx. Then you'll see the trachea going down. Behind that would be the esophagus, hence the softer tissue. Right here you'll see the cricoid cartilage, and then you'll know that this is the trachea because you'll see the trachea has cartilage rings around. Going up closer you'll see the thyroid. Right there. The thyroid gland would be located on each side. In humans, we only have it just one, and it's shaped like a butterfly. But a cat, on the other hand, has one on each side, and then the thyroid cartilage. And above more would be the hyoid bone. Same structure as the human. I know that humans and cats have very, very different structures. But just before I forget, I wanted to talk about the anatomy of the respiratory system and the head area. Located up top, you'll see that there's a hard palate. Humans have just the same. And then behind that would be the soft palate. Posterior to that, there'll be a very large area which would be called the nasal cavity. Located posterior to the nasal cavity, you'll have the pharynx. And there's different sections of the pharynx known as the nasopharynx, oropharynx, and laryngopharynx. Okay, following the trachea downwards, this will lead you to the lungs. The human and the cat, they are very similar, however they're very different in anatomy as well, because the human lung has 2 lobes on the left side and 3 lobes located on the right. However, the cat has, many different lobes. Okay, right here we're looking at the lobes of the right lung. On the top will be the anterior lobe, middle lobe, posterior lobe, and then there's a little tiny, this is the posterior lobe, and then there's this other flap, and that would be known as the mid-sagittal lobe. On the other side would be lobes of the left lung. And on top would be the anterior, and then of course the middle section, and then the posterior. Obviously located in the middle would be the heart, in exchange with oxygenated rich blood carrying to the lungs throughout the cat. And then located under the lungs would be the diaphragm. So when you're exhaling, the diaphragm will basically move upwards while the chest is going in. And again, the diaphragm separates the respiratory system from the digestive system structures. Okay, let's say we got super close to the lung and magnified it. And on the outside of the lung, there would be a very, very thin membrane called the visceral pleura. Between the visceral pleura and the parietal pleura would be the pleural cavity. And that pleural cavity protects the lungs from any negative pressure or damage. So basically when the lung collapses, this is when air gets inside that pleura, causing the lungs to collapse. When your lungs collapse, this means that the alveoli shut like this. And that concludes my quick tour of the respiratory system. I hope you enjoyed. Next I'm going to be talking about the digestive system. Thank you.